Recovery after aortic valve repair generally involves about 3 or 4 days in the hospital, sometimes a bit longer, and then about 4 weeks to start feeling pretty good again, and maybe 8 to 10 weeks to get back to 100%. With a sternotomy, it's like having a broken bone anywhere else. Time to full healing of the bone is about 8 weeks. And that's pretty much the determining factor for the time to be able to go back to work if you have a physical job or get back to full activity. Patients who have a robotic approach have all the same in-hospital routines, but often are able to get out of the hospital a day or two earlier than if they had had a sternotomy. The recovery after leaving the hospital also tends to be a bit quicker because they don't have to wait for the bone to heal. So many patients who have the robotic approach are able to get back to full activity within about 6 weeks of the operation. After you go home and throughout your recovery, we'll be available to answer any questions and manage any issues that arise during your recovery. That postoperative visit usually happens 3 to 4 weeks after you go home from the operation. At that visit, we'll check and make sure everything is healing well. We will do an echocardiogram to look at your heart valve and your heart in general, as well as a chest X-ray and EKG. If all of those things look good, you'll be cleared for a return to full activity. We will want to see you periodically in the future, usually once a year with follow-up echocardiograms to make sure that everything still looks as it should. We have seen some of our patients with aortic valve repairs back for several years now, and we believe that aortic valve repair is a very durable way of treating aortic valve disease.